welcome back to Learner's World. September is Alopecia Awareness Month. So today's video is going to be over alopecia areata. I will have a Quizlet linked in the description box below if you wanted to check that out. So without further ado, let's get started. Starting off with, what is alopecia areata? Alopecia areata is an autoimmune disease that attacks hair follicles. Typically, it's seen as patchy hair loss, though it can occur anywhere on the body. It most commonly affects the hair on one's scalp. So, some frequently asked questions about our alopecia areata. So, first up, how common is it? It affects as many as 6.7 million people in the US alone. About 2% of people around the world experience alopecia areata. How is it diagnosed? It is diagnosed by the symptoms. So this is going to be hair loss and the pattern of hair loss. The doctor may also take a family history to see if there is anything else that might be able to explain the hair loss that the patient is experiencing. Can children get it? So people of any age can get it, though it does often start in childhood. Can it be caused by trauma or shock? Yes, it's common for hair loss to happen after traumas, but this typically isn't the case with alopecia. How will it affect one's life? The person isn't going to experience physical discomfort or disability like other autoimmune diseases, but it will most likely affect how they feel about themselves. Can you pass it on to children? Most children with alopecia don't have a parent with alopecia, and most parents with alopecia don't pass it on to their children. What does the National Alopecia Areata Foundation, or NAAF, do for those with alopecia? They provide support to people who live with or who care for people with alopecia areata, raises funds and awards research grants to study alopecia areata with the hope of developing effective treatments and ultimately a cure. Acts as the International Center for Alopecia Areata Information and educates state and federal officials on the need for fair insurance laws and greater government-sponsored medical research. So now the meaning and classifications of alopecia areata. So alopecia means hair loss or baldness, and areata means occurs in small random areas. Alopecia areata totalis, so this is going to be total hair loss on the scalp. It affects a small percentage of patients with alopecia areata. Next we have alopecia areata universalis. This is a total loss of hair on the scalp and the body. It is the most severe form of alopecia areata. Diffuse alopecia areata, so hair thins as opposed to falling out in patches. It is common and affects up to 50% of men and women, which the thing about this is it's going to present more frequently in women than it is in men. Ophiasis alopecia areata, the person loses a band of hair on the bottom and back sides of their scalp. This is called the occipitotemporal scalp. It is a subtype of alopecia areata that presents as a symmetric band-like hair loss pattern on the occipital, temporal, and parietal regions of the scalp. What are the treatments for alopecia areata? So common treatments for mild or limited alopecia areata. So you have topical corticosteroids, which reduce the inflammation around hair follicles, helping the hair to grow, often combined with other treatments. Then there's intralesional corticosteroids, which is the most common treatment for adults with patchy alopecia. It is an intralesional injection of corticosteroids. A fine needle injects the medication into the areas where hair is missing. Then there's minoxidil, which is an oral treatment that comes in tablets of 2.5 milligrams, 5 milligrams, or 10 milligrams. Most often it is used in combination of other treatments. Common treatments for moderate alopecia areata. So you have pulse corticosteroids. So these are corticosteroids given at a high dose in regular intervals, usually given over a short period of time, typically given orally. Topical or contact immunotherapy. This can cause an allergic rash, which the rash is called an allergic contact dermatitis. And the rash develops where the immunotherapy is applied. It changes the body's immune response around hair follicles. The immunotherapy agents most commonly used include squaric acid dibutyl ester, abbreviated to SADBE, or diphencyprone, DPCP. Then you have dupilumab, commonly called Dupixent. So about 1/3 of people with alopecia areata also have atopic dermatitis or eczema. It is a monoclonal antibody that the FDA approved for treating atopic dermatitis in adults and children as young as 6 months. Dermatologists may prescribe this as the first line of treatment for people with alopecia areata and atopic dermatitis together. Common treatments for severe alopecia areata. So the most common one is JAK inhibitors. So there are 3 JAK inhibitors that are FDA approved for alopecia areata. So you have baricitinib, also called Olumiant, which is approved for adults 18 and older. Then you have rituximab, also called Litfulo, which is approved for adolescents 12 years old and up. It is the only JAK inhibitor currently FDA approved for the use in children. And you have duruxolitinib, also called Leqselvi. It is approved for adults 18 and older, and JAK inhibitors are immunomodulatory drugs. So there's psychological and emotional effects that come with alopecia areata. So depression and anxiety. Among 75 patients, the prevalence of depression and anxiety were 66.7% and 73.3%, with a median depression score of 5 and a median anxiety score of 5. A study in 2022 reported that adults with alopecia areata were 30 to 38% more likely to be diagnosed with depression, and the 2022 study also found that about 33% of adults with alopecia areata have anxiety. Feelings of embarrassment and shame. It gets said that hair is a person's crowning glory, so those with alopecia areata might feel embarrassed and ashamed by their hair loss. The shame felt may lead to social isolation. Low self-esteem. Many people associate hair with attractiveness and their personal identity. Because of this, some with alopecia areata may have a low self-esteem. The low self-esteem may also lead to other aspects of life being affected, such as personal relationships, participation in social activities, or their professional life. Dealing with hair loss and grief. So grief is common in the early stages of hair loss. It is considered a normal reaction that is a necessary part of learning to cope with changes to one's appearance. The grieving process is as follows. 1. Shock and denial. 2. Pain and guilt. 3. Anger and bargaining. 4. Depression, reflection, and loneliness. 5. The upward turn. 6. Reconstruction and working through. And 7. Acceptance and hope. So loss. The feeling of loss ties in with the depression the individual may be dealing with. For example, they may have a loss of interest or pleasure in hobbies and activities. They may also have unintended weight loss or gain. Experience of alopecia areata across age groups. So with the pediatric and adolescent age groups, so 65% of patients experience their first episode with alopecia before the age of 16. Pediatric, so most children who experience alopecia will experience limited hair loss. Depending on the child's age, the extent of hair loss, alopecia may be psychologically disturbing because they may face teasing or bullying from peers. Affects 1 in every 1,000 children and teens. Adolescents, a study done in 2017 found that 48% of teens are embarrassed about their hair loss. 7% said hair loss affected friendships. 59% said that they have been stared at or people have talked about them. And 52% said that their hair loss made them limit their activities. Adults, so onset of alopecia areata is typically going to occur during young adulthood. And if the onset of symptoms occurs after the age of 50, it is called late onset alopecia areata. Hereditary factors and risk factors. So, hereditary factors. Alopecia areata is a T lymphocyte-mediated autoimmune condition which occurs in genetically susceptible people. It is a histopathological the histopathological findings have revealed inflammatory perifollicular infiltrates of T cells around the anagen, which is the growth phase of hair follicles, which consists of both CD4 plus and CD8 plus T cells. Scientists may have linked several genes to alopecia areata. And risk factors. One is family member who has alopecia areata, which may mean that you are at risk of developing it. Two, being people with other autoimmune diseases like psoriasis, vitiligo, and or thyroid disease are more likely to have alopecia areata. And three, being there is a possibility that alopecia areata may be caused by emotional stress or an illness. So that is all I have for you today. I hope you enjoyed. If you did, please hit the like button. And if there's something you want to learn more about in the future, please leave it in the comment section below. And I hope you have a great day. Bye!